Hello, friends. Hello, and welcome to Tuesdays with Tina. Happy to see everyone today. I know we've got some kind of weird lighting up above my head, so I apologize for that. Just popping in. It's been a bit since I've been able to come in and chat with you live on some anesthesia items, workplace issues, medical emergencies, head and neck, all the things. So I wanted to pop in and say hello. Hope everyone's doing well. This last weekend, I was in Georgia certifying some dental hygienists on Saturday and Sunday with local anesthesia. And then today I get to be with my hygiene students, helping them learn how to give palatal injections, right? The greater palatine, the AMSA, and the NP injections. Those really are pretty fun injections, I think, those palatal injections. And while palatal injections isn't the top thing that I want to talk about today, I will just kind of give you some reminders with it. Look at that. I've got my little skull here. He's been named Alan from some other dental hygiene friends from when I was speaking at a conference. I brought little Alan with me. They helped me name him. Isn't he cute? So, by the way, I'm happy to come and speak to your organization as well, and you can help me name more schools. So anyhow, tips with palatal injections. One of the best things that you can do for your patient is to get your cotton swab and apply firm pressure to the area you're about to inject. So really like firm pressure, like you should be pushing hard enough that you can really see that tissue blanch and being able to provide that pressure anesthesia to that area. What it does is it basically blocks the flow of communication of that nerve. So that way the patient doesn't feel it. Like you fall asleep on your arm, that's pressure anesthesia. So it makes it so that injection is a lot more tolerable. You may not even need to use any of your benzocaine with that as well. So wanted to share that with you. But really, one of the things that I wanted to talk about, and which I find is very interesting, is when I was in Georgia working with a hygienist there, getting them certified, I get to work with a lot of different dentists and listening to their education of local anesthesia in comparison to dental hygienists' education on local anesthesia. And it really got me thinking about the standardization of education. And now with so much information coming out now from different dental organizations about educational standards of who can come in and provide different services based off of where they lived geographically, or whether it is if it's they moved into the United States or if they live within the United States and move from one state to the next. The educational standards, the scope of practice that is happening within our profession of dentistry, not just dental hygiene, dental assisting, dentist, dental therapist, that my observation is while there are some standardizations, but in general, it's not. And hearing a dentist talk about the education that he and she have received in dental school and regarding local anesthesia. Now, I know that not all dental programs operate this way, but to find out that it's maybe a 3 or 4 hour, what they call stab lab, right? 3 or 4 hour interactive lab class before they go work with patients. And then that's it. When comparison with dental hygiene, it is quite a bit more extensive of detailed information, direct observation, feedback is given for each injection. Now, I know that not all dental school programs are that way, but it's one of those items where it's like, okay, where is that standardization of understanding of the education and allowing that to happen? Learning that, that this one doctor that I was talking with over the last couple of weeks informed me that when she didn't learn detailed infection control while she was in dental school, it wasn't until after dental school that she took it upon herself to learn detailed infection control. And I think that's kind of interesting. I really think it's interesting. And with some of the resolutions that are coming out from different associations stating the need to address the workforce issue, I definitely think that is a big thing that we do need to address, for sure. And I do think that we need to identify also ways that we can um, increase collaboration and calibration with our education and our educational standards, and the importance of having a great instructor to student ratio in order to maintain that high quality education. It's very important. And then also to recognize that every single profession in dentistry has different things that they are educated on and at different levels, and to understand that and respect that. And when new things come up, as we all know, like with hygiene, we've heard this so many times within dental school, a dentist may get a couple of week course on perio, while a hygienist, that is our entire education, is on the periodontal disease. And while in dental school, a dentist will receive a huge amount of education on restorative care. That's different in dental hygiene school, right? We'll receive, depending upon which state, less education behind that. So respecting that education level for each profession. But I do definitely think it is important to have a conversation about quality education and what that looks like, and what that looks like within dental assisting, dental hygiene, and dentistry, and the importance of having quality educators and having appropriate contact time with each student to assure that they have learned and are competent for the public that we serve. So I'm really curious to see how some of these things play out. And I really encourage you, if you are curious to learn more about the ADA resolutions that they put out about foreign trained dentists, about reducing the instructor to student ratio, hearing a lot of these things, I really encourage you to head over to this podcast called Straight Up with Steph. It's called Straight Up with Steph, and I'll try to put a link somewhere. She had a great conversation with Alyssa Aberly regarding this whole thing, and it was wonderful. So I encourage you to take a listen to that, just to hear some more perspectives. And if there's anything that's going on where you are like, I'm not sure if I agree with that, or if I do agree with it, or why did my professional association choose to go that route? The best way to find that information out and let your opinion be heard is actually to be a part of your professional association. And if your professional association has approved something or supporting something that you may not necessarily agree with, then maybe you aren't a part of that association and haven't had a chance to let your voice be heard. So be a part of your professional association. Your professional association really is the entity that's looking out for you, right? They are looking out for you. They are looking out for you as the assistant. They're looking out for you as the hygienist, and they're looking out for you as the dentist. So be a part of your professional association. Let those who have the passion to work for us have the people behind those numbers to help them out. Because the best way is, it's kind of there's power in numbers. So be a part of that number and join the conversation that way. So I will talk more anesthesia, medical emergencies, head and neck anatomy, you name it, all next week. But I thought it was such a very interesting time right now as we're hearing about all of these things that are happening at the national levels. Doesn't mean that it's happened. It's just started the conversation. It has started the conversation. So, and actually, as soon as I'm done here, I'm going to go log into ADHA and renew my membership. So I hope you do too. I challenge you. Okay? I challenge you. All right, friends. See you next week. Bye-bye.